Good morning or good afternoon, depending on where you are joining us from. My name is Melissa Faulkner, the VP of Marketing. We are the Digital Health Hub Foundation, a digital health accelerator at the Worldwide Center for Healthcare Innovation. Now in its sixth year, our awards program is dedicated to identifying the most transformative, disruptive, and innovative companies that are shaping the future of healthcare. This year, out of over 1,500 applicants, 300 were named quarterfinalists, and we've narrowed it down to our 150 exceptional finalists. Today, we are proud to present our 10 digital health finalists, leaders who are truly revolutionizing this space. As a reminder, this session will be very fast-paced as we have 10 companies to present, but this is only a small taste of what these companies have already shared as part of their application. And again, this session is recorded and an edited version will be shared out. If the audience has any questions, please feel free to drop them into the Q&A and we will try to get to them. I would now like to introduce Matthew Holt, one of our executive producers, as well as the founder of the Healthcare Blog and Health 2.0 conference. Matthew, take it away.
Thanks so much, Melissa. And I still don't think that cartoon looks anything like me, but you can figure it out. All right. So real quick, the way this is going to work is that we have our 10 finalists, and we're going to go around each of them in. They're going to get about 90 seconds each, and I'll call them each out to explain what their company does and basically answer their first question. And then after that, there's another couple of questions. We'll keep going around until we run out of time. This thing will end at about 11:55 West Coast time, so we have about 50 minutes to get through. You will hopefully discover a lot more about oral health and dentistry than you already know by the end of this session, especially if you're one of the judges watching this now live or on the recording before you make your final vote. I will show you my teeth. I'm British and I was born in the 60s, so don't expect me to have beautiful teeth. But now I'm an American and I have kids who spend $1 gazillion. Well, I spend $1 gazillion for their orthodontics and stuff. It's very important to understand how important teeth are in America. And it's not just for Hollywood and looking good on your headshot on LinkedIn. There's actually a lot more to do there. So I thought we have a category champion in each of our categories, most of our categories. And for this one, I want to introduce Maria Filipova. She is she at one point was running innovation at Anthem, and these days is doing a lot in oral health. And Maria, you're going to tell us a little bit about why. You're going to grab the screen. Hopefully you can.
Love it. Yep.
Introduce yourself and say a little bit about why oral health matters.
Yeah, thank you, Matthew. And I actually do believe that this cartoon looks like me, or at least a version of me when I had straight hair. So kudos to the artist who made that happen. At least, one out of the two, I think we could totally.
Well, by the way, I actually have 3 different HALTH cartoons, and one of them finally looks like.
Of course you do. Of course you do. So great to meet you, everybody. For those of us live or joining us live, or for those of you who are going to be listening to the recording later, I have the privilege of joining the Digital Health Hub team this year for the first time, and I'm beyond excited to have the Dental Health Award, the inaugural Dental Health Award as part of the Digital Health Hub Foundation awards this year, which is a testament of the importance of oral health in overall health. I'll just give you a little bit of the magnitude of the impact that oral health has on overall health. And I will try to preserve as much time as we can to hear from these amazing teams who are actually operationalizing that connection between overall health and oral health in real life. So as Matthew said, in my prior life, I used to run innovation at Anthem, now Elevance Health. And from that perspective, I got to see a lot about how healthcare cost is managed and how we need to really try to deliver higher quality outcomes at a sustainable cost. And from that perspective, over the last couple of years, I've been learning a lot about the clinical connections between overall health, clinical health, the health of your mouth, and the health of the rest of your body. So even though Matthew started us with beautiful smile, a beautiful smile is also a healthy smile, and a healthy smile means a healthy body. Again, going back to the cost of things, so there's over 69 inflammatory systemic conditions that are connected to periodontal disease or caries or other diseases in the mouth. I have picked up a couple of those diseases, from hypertension to diabetes to dementia, who happen to be the most costly diseases that we spend over $1.2 trillion in healthcare today. And you could see that in this chart alone, for example, if you have periodontal disease, you are 2 times more likely, or between 1 to 2 times more likely, to also have some sort of a cardiovascular disease. Or if you're a diagnosed diabetic patient, and if you're not taking care of your periodontal disease, your 20%, your A1C levels are going to be 20% higher than somebody who's taking care of their periodontal disease. So the premise behind the digital health awards in dental health was to not only remind us of the clinical connection between clinical outcomes and oral health, but also help us find the solutions and the companies who are putting those connections into the workflows of care teams, into the technology stack of clinical delivery and care delivery, or they're thinking about the next generation of diagnostic tools to make that happen. So with that, I probably also wanted, so that's the first point. The second point, for all of you who are looking at investing in healthcare, healthcare is a thriving space. Digital health is a thriving space. Oral health is an overlooked space within investing. We know that even though oral health is about 4 to 6% of the total spending, the investments that go into oral health companies are about only 1% of the total investment that goes into digital health. So when we say there's opportunities, that investment is so low, not because of the shortage of high quality companies, which you will hear from and see for yourself today. So excited to dig in and get us started with that grounding on the importance of oral health and the opportunity for investors and executives alike. Matthew, should we kick off with our first question, and that would serve as an introduction
why
to our...
Why don't I ask the first question as an easy one, and then you're going to ask the follow-up question.
Great, let's do it.
That'll be complicated, but the first question is really let's introduce your company, and I'll go around here. So first question is an obvious one. 90 seconds or less. How does your solution improve oral health and overall health? And as much as you can quantify the outcomes your solution drives as possible too. So I'm just going to go around. I'm going to pick people down the list, and I'll start off with Videa Health, which I hope I pronounced it correctly, and Florian.
You're on mute, Florian.
Yeah.
There you go.
Awesome. Hello, everyone. My name is Florian. I'm the founder and CEO of Videa Health. Prior, I was actually in medical school and founded several other companies, and then launched this company with the goal to improve overall healthcare globally. So how do we do this? We are the leading dental AI company to support clinicians in diagnosing and treatment planning 2D dental x-rays. So that is the standard diagnostic procedure. And what we've been seeing is that patients with our AI that get diagnosed and treatment planned with our AI versus without our AI get the right treatment much earlier. So we diagnose up to 5 years decay earlier than the clinician alone, as well as the patients trust the AI more, and thus they convert to treatment more. So we actually know that every second patient we diagnose and treatment plan, they get a much less invasive and less costly treatment much earlier, rather than to delay treatment, which then increases cost. And also what you said, Maria, also increase the risk of hypertension, diabetes. And we are doing this in a significant scale. So we have over 40,000 dental clinicians using our platform now and process over 30 million patients per year. So we hope that we actually help over 50 million patients, so to say, every year right now to get a less invasive oral disease. And then also with that, systemic health issues around hypertension, diabetes, etc. Yeah.
Love it. Great to manage your time, Florian. All right. The bar is set high. Yes.
they take orders well. Don't listen to the English guy about the German.
Nicely done.
Next up, it's Dinesh from Uptime Health.
Good to meet everybody. So Uptime Health, we help people manage and keep up and running their equipment that takes care of the patient. So we see healthcare as a combination of a patient, a provider, and an instrument or a device of some sort. Healthcare really isn't provided without that third variable. When was the last time you got an X-ray or a dental X-ray without a dental X-ray machine like a CBCT? So these things need to be calibrated, up and running, in quality to produce quality outcomes, so other companies can actually run their AIs and everything on top of it. So what we're looking to do is solve that variable where people don't really understand how to take care of their equipment in these environments by giving them a tool that automates based on what they own, the things that they need to do to take care of it. And if it does break, they can dispatch service from our marketplace. And our system is mining the data as it happens. So we can now do things like predict failure events, know cost of ownership in the future year of the device, and help them forecast when they should get rid of problematic machines before they become problematic and disrupt patient flow. Because at the end of the day, we see that as a big access problem. And the further these offices are away from a technician community or a large, densely populated area, the harder it is to get somebody out there to fix it and repair it and put it back up and running so people can get the care they need. So if we can reduce those moments, we can increase access as well as make sure that everyone's getting proper care.
Very well behaved. Good explanation. Well done. All right. Next is AuraQ AI with Amrish.
Hi, everybody. My name is Dr. Amrish Khanna. I'm the founder and CEO of AuraQ AI. We are redefining dentistry by driving precision care chairside, helping to answer the problem that many patients have every day, which is, why did one dentist tell me one thing and another dentist tells me something else? And one dentist brings up a crown or Invisalign and the other doesn't talk about it. So when it comes to how this problem is leading to major lost revenues for a dental business, but huge negative outcomes for patients, because it's depending on the clinician's ability to be able to look at how they assess that patient and bring their knowledge and ability and experience to that interaction. And it's that when we talk about how we tie into improving overall health and systemic health, and what you were showing again, Maria, it said, how do we bring the mind and the wisdom of 1,000 dentists to every interaction, standardize the assessment process. So we're looking at everything holistically on that patient, from medical history to all dental findings, and directly engaging with the patient throughout their entire wellness journey, so that we can understand, why does this one patient need that crown today? The other, we can watch that cracked tooth. And when it comes to systemic health, medical risk, sleep apnea, inflammatory disease, these are all key aspects of our solution. So now you could have a new graduate clinician or somebody who's been practicing for 30 years, or a dental assistant or hygienist, all following the same way to assess that patient and making sure we can drive precision protocols to help that patient. Driving risk reduction, early intervention, and prevention is really the key. As you shared, these are things that we're spending trillions of dollars on. And if we can tackle these things earlier, then we're helping patients and bettering the system as a whole.
Beautifully done. Thanks, Amrish. All right. Next up, I'll just remind you all of the question, because it's been a couple of minutes since I asked it. In 90 seconds or less, how does your solution improve oral health and overall health? And if you can quantify the outcomes that your solution drives as much as possible, so much the better. All right. Next up is Auris DX with Harold.
Hello, my name is Harold Stelzer. I'm the CEO of Auris DX. Our mission is to detect disease early to allow patients to live fully. Our first indication is for the detection of oral cancer, where we combine the simplicity of a salivary rent sample with most advanced DNA sequencing technology and a multi-omics algorithm that simultaneously checks for patients for oral cancer and high-risk HPV status. Our assay boasts an accuracy of over 93%, giving patients and doctors a fighting chance to act early. No other test has these combined attributes, either on the market or in development. Oral cancer, as a reminder, oral cancer is the 6th most common and 6th most deadly form of cancer. Our team evaluated the annual oral cancer burden on the US healthcare system. There's $160 million of needless biopsies every year, as 80% are negative. An additional $5.5 billion is spent on surgery, hospitalization, and treatment for later stage cancer 3 and 4. And finally, 12,000 people are dying each year from oral cancer, which amounts to $1.5 billion annually for end-of-life care services. All these stats can be decreased with the Auris DX test on the market.
Thanks, Harold. Wonderful. You gave us back a few seconds as well, so I appreciate that, but super important. All right, next.
I'm German too, by the way.
I love the way the Germans are
overachievers. Everybody's
all
like,
these
"You give it to me
overachieving
80
Germans.
seconds, I'll get it 86. This is what we're dealing with here. Great.
Feel free to take your full 90 seconds, everyone. All right. Next up, Overjet with Wada. I hope I got your name right, Wada.
Hi. So at Overjet, we're helping dental organizations improve oral health. We serve providers where we've been able to help improve the diagnosis and the education that they're providing. From our clinical studies, for example, detection of cavities for children, we saw 100% improvement in the accuracy of review, as well as 57% less missed treatment that happened, or misdiagnosis that happened. We also serve DSOs. So these are organizations that have multitude of practices to help standardize care across their practices and improve the treatment acceptance rate as well, which is a big challenge for these companies. We serve, the third constituent we serve is insurance companies. We've seen a decrease of at least 50% of administrative cost of claim review in these companies. And then fourth, we serve dental schools, where we've seen, for example, Florida Dental School published that they were able to improve detection of cavities by more than 40%. So we serve, four major constituents where we've been able to help provide a platform that can improve the care that is being provided and reduce the cost that's being incurred as well.
Great. Amazing.
Right. Yeah, no, you're not even German and you're coming in under time. Fantastic. All right. Brilliant. Okay. Next up is Vesper with Amir.
Hi, my name is Amir Rouveni. I'm the CEO and co-founder at Whisper. Whisper has developed the most advanced sleep diagnostic and management platform on the market. Right now, we have one of the most effective patient success rate with 99% success in diagnosing, but also managing the patient over time through titration and outcome management. At the same time, we provide sleep lab grade data to the provider to make sure that they get an educated clinical decisions to their patients. So why sleep and oral health? So dentists are already taking part in the therapy for sleep apnea. They're developing mandibular devices to treat sleep apnea and snoring. And what we help dentists do is expand their reach and not only treat the teeth, but now the patient airways, which is a very important piece of the overall health. There are in the US about 80% undiagnosed and untreated sleep apnea patients. 200,000, we help the 200,000 dentists out there to reach those patients, help them with the diagnosis and outcome management of their patient to deliver better outcomes.
Great.
Fantastic. All right. Next up is Great Gums with Erica.
Hi, everyone. I'm Erica Michael with Great Gums. Great Gums is revolutionizing the toothbrush. Our bioelectric toothbrush uses 10 million waves per second to target the hard-to-access plaque in between your teeth and around your gum line, and is clinically proven to reduce gum inflammation by 75%. We reduce bleeding by 59%, and we are 67% more effective at preventing caries in the mouth, which has a whole host of implications for downstream health in a positive way. And not only that, it's just really fun to use. Our blue light is the indicator that lets you know that our toothbrush is working, because unlike a traditional electric toothbrush, our toothbrush does not vibrate, which helps protect your gums and enamel. We are bringing this solution over from South Korea, where we already have proven success with over 500,000 toothbrushes sold.
Brilliant. And your Korean counterparts were in the Erica, were in the accelerator that you may have noticed was also at the Digital Health Hub booths at the health show last time. There's a whole group.
Yes, exactly. And our inventor Youngwook Kim will be with me at our booth this year. So we're excited to be there.
And he's given me one of his toothbrushes, and apparently my teeth are cleaner now. So there we go. And the other thing you didn't say is that the blue light stays on for 2.5 minutes, right?
Yes, the blue light is your timer so that we can ensure that you are brushing your teeth for the recommended amount of time.
It's probably the only time in my life I've ever brushed my teeth for the recommended amount of time. All right. Okay.
About you, Matthew, on this call. I mean, we're all getting to know you very well, very intimately about your oral hygiene routine.
Go watch Austin Powers. You want to think about British teeth from the 60s. All right. Okay. Next up, it's Philippe from Dental Monitoring.
Thank you, Matt. Thank you, Matthew. So I'm Philippe Salard, founder and CEO of Dental Monitoring. What we believe is today the healthcare system is crowded by unnecessary visits all along treatment. Most of the technology focus on early diagnostic of a problem. Us, we focus on what is happening during the treatment. We are a treatment monitoring solution. We help the doctor to synchronize the delivery of care with the need of care. Too often, a patient is coming to the practice and it's a surprise for the doctor about what is coming at the chair level. So we anticipate always these visits by informing about what is happening inside the mouth of the patient to the doctor that is capable of adjusting his appointment according what is currently inside the mouth. So we act in many fields in orthodontics, mainly in dentistry, mainly in orthodontics today in the US, where it represents more than 50% of our business. We operate in more than 50 countries to date, and we monitor more than 1 million patients every single month, which make us today, and very proud about that, to be the first unicorn in the dental space.
Fantastic. I'm very upset that a French guy is obeying the rules, but you know,
yeah,
God knows what happens.
After 2 German, you needed 1 French, at least.
In this crowd, everybody's on top of it, which is
it.
great because that means we have more time for discussion and for questions that maybe we could take a couple from the audience.
Yeah, fantastic. All right, next and last up is Alex from Diagnoccat. I hope I got that right. Diagnoccat. You'll correct me, Alex.
Diagnoccat.
Thank you.
Diagnoccat is all-in-one artificial intelligence software for 2D and 3D dentistry. There are 3 reasons the Diagnoccat solution dramatically improves oral health and overall health. First, while 2D AI detects basic conditions like caries or periodontal disease, we also do that. Our distinct, unique offering is Diagnocat's 3D AI. It is the best way to diagnose more complex oral health issues linked to systemic conditions like heart disease, diabetes, or gastrointestinal disorders. Secondly, Diagnoccat AI performs over 100 different dental detections. However, its capabilities extend beyond dental concerns. It also can identify tumors of the jaws and sinus pathologies. And lastly, we reduce overall healthcare cost. Imagine you're a dentist. Typically, to get a radiology report for a 3D dental image, you would send it to an oral radiologist, wait up to 20 days, and spend around $200 per report. With Diagnoccat, you can complete the same analysis in just 3 minutes, not weeks, not 3 weeks, and at a fraction of the cost, about 10 times less, with just a click of a button.
Fantastic. And next up, you weren't the last. I missed one. It's Pamela from Grin. Apologies, Pamela, but I've
yes, there you go.
All right, but now the last.
Yeah, can everyone hear me? Okay, great. So I am here actually standing for Adam, who's my co-founder and CEO, and unfortunately couldn't make it due to a family emergency. So I'll try and keep it short at 90 seconds. Grin applies digital technology and AI to responsibly transform oral care by reducing hassles for consumer and democratizing access to dental and orthodontic resources, reducing hassles for the provider while increasing their practice revenue and profitability, and most importantly, systematically reducing the total cost of care while improving quality. How do we do that? We actually have 3 components to our platform. We have a simple yet thoughtful medical device that connects to any phone and can virtually help the doctor reach into the patient's mouth. We also have a web app for the doctor and an app for the patient. So Matthew, when you were holding your teeth and your smile at the beginning of the call and trying to help us all see your teeth, had you used the Grin Scope, we would have been very well be able to see every aspect of your oral cavity very well. We get very high scores on the quality of images that we can kind of transport to the other side for the dentist to be able to see. We help, we're proud to help on the early detection, accessibility, personalized care, education and engagement, and some other very important drivers in this space. Grin has over 3,000 clinicians using the platform, touches lives of over 100,000 patients now, and we are very proud to increase access to care and therefore also kind of improve oral health and thereby also improving kind of overall systemic health by allowing to get those images as reported through studies 4 minutes faster, but also allowing from traditional methods, but also allowing the clinician on the other side to be able to review those images 6 minutes faster, which allows him to add a lot of time back to those operatories and practices to be able to take care of more patients in a better way. Thank you.
Thank you, Pamela. And because you are the only one who went slightly over your time, you get to be put on the spot to answer the follow-up question first. Florian kicked us off beautifully as the first one to go on the first question. Everybody has done a great job identifying and quantifying the impact that your solution is uniquely positioned to make in the market, in the oral systemic health connection. We are really looking through this competition, through this award, we are really looking to find the solutions that are built to scale and that would have that transformative impact. So when your solution is at scale, it's widely adopted at scale, what's the impact you would see on patients, care teams, education, and or payers? Some of these segments may not be part of your customer group, but we're making this harder now. It's only 60 seconds. And so what is the impact? What is the change you would enable in the ecosystem for any of those segments when your solution is widely adopted?
Thank you. Only 60 seconds and a lot to say here. But to be honest with you, we would be able to turn the table on value-based care is what we feel. We would turn this whole idea of oral care into being a reactive situation into a proactive situation. We have the advantage of actually being able to meet patients where they are at their homes and, like I said, transport those very quality images that is helped also by AI detection to help the clinician, to help the patient be treated earlier. And, you know, it all comes back to the digital, on one part, the digital transformation, but also in the other part, one of our board members has a book that, you know, I love quoting, but the title of the book is Not Just in Sickness, but Also in Health, right? We are able to kind of see the patient and take care of what's needed, educate them, and educate the general public, kind of not just, if we're lucky, a patient is going to see the doctor or the dentist, you know, twice a year. This allows us for much frequent touch points. And, you know, ideally, we could reverse this periodontal epidemic disease that you were talking about, right?
Okay, Pamela, thanks. That's
great. Thank you. I want to make sure everybody has a chance to answer that question. Yes. So for this one, let's go through, since we talked a little bit about for this answering this question, let's start with the companies that are working on AI specifically. We have a couple of companies diagnosing, providing decision support. Let's hear from that group of companies first, and then we'll go to some of the diagnostic companies in the mix. So I'm gonna call out folks, or feel free to jump in. Right in front of me is Dr. Amrish Khanna. Or actually, no, I saw Felipe go off mute. So Felipe, do you want to kick us off?
Okay, so yes, today we have developed more than 130 neural networks that constantly look after the problem that can be detected remotely inside the mouse of the patient. And how we will impact the world? We are impacting the world by reducing drastically the number of unnecessary appointments that doctors have. If you take a normal treatment, for example, in orthodontics, where you will have 20 appointments, we reduce by more than 40% of unnecessary appointments, which is a huge, huge saving for the patient, for the doctor. And all this by providing better care, because we bring the patient when there is a problem. We don't bring the patient when there is nothing to do. And by bringing the patient when there is especially something to do at that moment, we just elevate the standard of care. So we believe that we are scalable by using AI. It brings us the capacity of answering to millions of patients every single month without the support of people daily. And we are already in 50 countries, which show that the scalability of the company.
Great. All right, I'm going to go next to Dr. Amrish Khanna, and the question is, when your solution is widely adopted, what is the change or the impact you would see on patients, payers, educators, or the care team?
Yeah, thank you, Maria. I think we've chosen to address that question and the adoption piece from two angles. One is driving precision care. So as I shared earlier, how do we really remove clinician bias, ensure that we can help any dentist, any clinician unlock the needs of the patient the right way when the patient's right in the chair? So how do we make sure we look at everything from full medical health, all the dental findings that we scrub, and the data that we pull from the practice management software to guide optimal treatment planning for the patient? The second big piece there is adoption. We're the clinical AI solution that is involving the patient directly through the journey. So the patient gets this the moment they sit up in the operatory. We hit one button, the patient gets this in the palm of their hands, and they get to see an overall wellness score that guides them to care. So how does that impact the patient's ability now to go to their physician, talk to their physician about something that's going on in their health, or their inflammatory markers were up, or so on? So that's really the big way that we're addressing that. We're capturing end-to-end data all the way from history to examination to what is an optimal plan, what does a dentist actually plan, to what's recommended, what a patient accepts, and build and reimburse. So that whole piece has tremendous impact to insurance, education, research, you name it.
Yeah, and I'm going to call out three folks who could jump in here, and maybe you could respond to that in that order. But we want to hear from Videa and Florian, from Overjet and Warda, and from Diagnostica and Alex. So jump in on that same question, please. Feel free to disagree with each other. This
Absolutely.
is a very friendly. Everybody has been way too agreeable here. So jump in. Yes.
Well, I think we're all working on the same mission, Maria. Maybe that's why.
I think that's it. Everybody's working the same. Yes.
Yeah, let me start. So here at Videa Health, it's literally in our name. I've been working in healthcare all my life, and before in breast cancer detection, etc. And the crazy fact is that dentistry, the majority of big treatments are actually preventable. Cancer is not, but a lot of dental treatments is preventable. And what we are working on is that we support the clinicians to identify treatment early and get the treatment done early. And so that will result in two big things. Number one, the high risk and high dollar procedures like crowns, implants will go down, and we can take much more preventative care. That's important. Number two is also the downstream overall health costs, hypertension, diabetes, they will significantly reduce. And so we're super excited about that. So we will have an impact, not just on oral health, but also on overall health at scale. And the great news is that we are already at scale. We have tens of thousands of dentists using our platform every day, and tens of millions of patients who benefit from it. And we are seeing this actually now already in the data, that the high invasive treatments go down and the lower go up. And I think that's great news for all of us.
I love it. All right, on that same mission of impact, reducing overall care costs by improving oral health interventions, Who else wants to chime in?
So I'll talk a little bit more about Overjet, and it's amazing to see how many people I know in this group. So it's a good group that you put together here. So we're this is the optimistic hat. As things work out and everything is great, we believe we're going to impact every human in the world. And dental disease is something that impacts everyone, and that's why we think it's so important for not only for us to work, but hopefully all these people to work in this industry as well. And with that, if you look at the dental disease situation right now, it is one of the most prevalent chronic conditions that we need to bring down. And as we bring that down, we also believe that we can help move the needle on, not only what the care is being provided, such that any dentist you go to, you get the best care, and you're able to then understand the care and then accept the care that is being presented to you and bring that, right now, the acceptance rate in the US is 50%. We need that to go higher for us to impact the care that is being provided. And in the meantime, we also believe that as we bring the cost of the care down with the insurance companies as well as the dental practices, we can have more money go towards patient care, which will help impact the care even further. So I do think the future is very rosy, and there's a lot to be done. But I think we, hopefully in the next 5 years, I can say we were much closer to this goal than now.
I like the theme of collaboration and rowing in the same direction in service of the same mission that every company has here bought into. Alex, what do you have to say about this? From Diagnostica, yeah.
Yeah, we see that this angle. In our 2023 study, we found that patients' agreement with the prescribed dental treatment for single tooth or lower cost treatments can reach as high as 80 or even 90%. But for more complex and costly cases, acceptance drops dramatically to just 15%. And to what Warda has just said, this is probably one of the reasons why dental disease is still the most prevalent health condition in human. And we at Dagnicat changed the health and healthcare ecosystem by its 3D AI that simplifies diagnostic process, communicates the findings in a way that patients understand and trust. And as the result, the treatment acceptance, especially for those who need it most, improves significantly, and it helps to close the gap between the demand and the delivery of care.
Yeah, brilliant. And so now that we, I like that the AI companies had this undertone of let's figure out a treatment acceptance, let's get the patient the optimal integrated plan, and prevent diseases that are preventable. They are diseases that are probably not preventable, that people are genetically predisposed for, like oral cancer. We have two companies in the mix that are disease condition specific. One targets treatment of sleep apnea, obstructive sleep apnea, or diagnosing sleep apnea, and then treating it with the dental care team. And the other is early diagnostics of oral cancer. So Harold and Amir, what is your take on this question in terms of the impact your technology would have on the overall system when it's broadly scaled?
Please, Amir, you start.
Yeah, I can go first. So what we offer to the dental professionals and the industry overall is having a real impact of oral health on the overall health. Sleep is probably one of the most important pillars of our health in general, together with nutrition and exercise. And by diagnosing, treating sleep apnea and the airways, dentists and physicians now can work together to improve the overall health of the patients. As I mentioned earlier, about 80% of people with sleep apnea are currently undiagnosed. The American Dental Association has announced and recommended dentists to screen and diagnose for sleep apnea, and we make it very, very easy for them to complete a diagnosis, to monitor the outcomes, and to achieve a real convergence in healthcare and really looking at the patient as a whole. That's what we see in the horizon. It's tough, but this is where we want to go. We want to see dentists and physicians working together to improve the overall health.
Harold?
Yeah, and I think we really have unique opportunity, and I'll represent saving lives. I haven't heard anybody say saving lives. We have a unique opportunity to bring precision diagnostics to the dental community, beginning with oral cancer. How do we measure that? Less late-stage disease, early detection. It's very preventable. We can look at it as the number 6th leading cause of cancer deaths in the world, and we can reduce that in no time at all with earlier detection. The second piece of this, what I was really attracted to, coming from a therapeutic side of the house for many years, is there's 160,000 dentists out there that see patients more often than the primary care provider. Imagine if we have a series of precision diagnostics, and we're already looking at esophageal cancer, we can consider Alzheimer's, we can look at infectious disease monitoring. All this can be done with the same type of technology. That's the underlying foundation of what Auris DX is developing.
And that's the promise of early detection. Well, from that perspective, we talk about prevention, catching disease early. Definition of prevention is oral hygiene. Great Gums and Erica, what is your point of view on the impact you want to see when everybody has a Great Gums toothbrush?
Sure. So I think the important thing to remember is that we all brush our teeth. So getting a Great Gums toothbrush is just enhancing your already established routine. It requires no extra steps for you, and we've also made it affordable. Our Great Gums One is under $30, which makes it accessible to almost everyone. And we do truly believe that prevention starts with the toothbrush, and we believe that once we reach scale with the Great Gums bioelectric toothbrush, we will see a reduction in the occurrence of periodontal disease and other oral diseases that we've all mentioned here. And this would lead to a shift from the treatment-based care towards prevention-focused care, which is what it sounds like we all envision for the future of oral care and oral hygiene. So this means that practitioners would see more routine checkups, and there would be fewer emergency treatments, fewer invasive treatments for patients, and there will be time for focus and education on oral health and how it impacts your overall health.
I think this is definitely one of the most educational webinars people would be listening to when it comes to oral health, with all the solutions here. Last but definitely not least, Jinesh, on Uptime Health, you guys are making it, you're ensuring that the team and the equipment and the infrastructure that's required for all these interventions or preventative procedures to happen is reliable. Tell us more about that impact that you're looking to make at scale.
Yeah, so at scale, we already have over 2,000 practices utilizing our software and over 5,000 utilizing our services for our at scale, what we're doing right now. But for the way we see it impacting the industry when we're fully deployed and, you know, well throughout.
What does that look like? What does fully deployed mean? Like, that's a good question. Define what scale looks like. Erica said everybody should have a toothbrush, a Great Gums toothbrush. I don't know, maybe you should expect something in the mail from Erica if that's what everybody on this webinar. But what does scale mean for you?
So for us, scale means like having at least 10% of the industry participating in our software, because the data set underneath it was really powerful for everybody that's involved. But going back to, somebody mentioned this earlier, the medical dental integration that's happening, our company right now is poised to help that transition. So we do is we also manage compliance efforts related to the machines in your practice, which is already mandated and regulated in medical. So if you're ever going to combine these two offerings, you have to have a better solution for the compliance and equipment management that you're going to do, and we will facilitate that. The other thing is with our data, when it's at that scale, we can predict things like failures, which will then also predict purchase, which we can get that information to distributors to make sure they have things on hand to give to the offices to reduce lead time. We can also give information back to the manufacturers that are helping them understand what issues are happening in their machines, because right now they don't even know what fails in their machines. As weird as that sounds, that's all blocked at the distributor level. So we can elevate that information to the manufacturers to make improvements, and therefore impacting the whole entire healthcare vertical. Better products, more available in the offices to facilitate the innovations we see here.
Great. All right. We are at almost at the time that we want to close up. I think everybody had a chance to answer the second question. For the last question, I'm looking at Matthew, and I know that he's looking at the clock and the watch.
We'll just say for the last question, it's a really short question, so these are word bites, not sentence bites.
Right.
All right. So everyone should get a chance to answer the last question, but far away on that last question.
What is the one thing, and you could choose, what is the one thing that you need to reach that exponential impact in your organization? Or what is the one ask you have from our audience? You can't answer both questions. It needs to be one sentence or one word. All right. Who's going to jump in first? Otherwise, I will go to, yes, no more than 10 word answers. I'll go to Warda. Warda, how about you? Do you want to kick us off?
So for us, it will be distribution if you want to reach every person here. So especially in the international companies, but distribution would be the blocker.
Great. Vidya and Florian, you had a great job kicking us off and keeping us on time. What does it mean for Vidya? What is the ask from Vidya?
I think for all of us also on the call is market education. Many people think it's the expert versus the AI. But it's actually the expert, the clinician with the AI provides better care than a dentist without AI. And I think that's why AI in breast cancer actually failed or had slow adoption. And I really want to avoid that in dentistry. So educating everyone, it's not a threat, it's a benefit and makes your job easier.
All right. Amir from Wesper, one word or two?
One word I would choose is payers. We need like the acceptance of payers to support the diagnostic and management of sleep apnea is such an important piece of the overall health.
All right. If you guys want to also put it in the chat, if it's one word, go for it. I'm going to keep calling out names on my screen as they come up. Dr. Amrish from OraQ.
For us, I'm going to say it's accelerating integrations. Like our users we've launched with Patterson Dental Canada, people want to see everything in one place. And having that accelerated integration, there's amazing people on this company. We're not doing imaging, we're doing everything else. How do we help serve our end users better?
Alex from Diagnostica. Alex, are you on mute?
Yeah.
What do you guys need to scale this proportion?
I did not recognize her name because it's Diagonal Cat. It's like a cat.
You know what?
Okay.
By the time you need to get on the stage and receive your award, we will learn your name. Don't worry about it. There's still time.
Yeah.
Yes.
Well, we are one-of-a-kind technology, and we're looking for experienced professional or partners, and this will create a powerful 1 = 11 combination, driving our exponential growth.
Great. Erica from Great Gums.
Yes, so I'm coming at this from a D2C lens, and the number one unlock for us would be awareness and top of funnel brand recognition. Word of mouth is a fantastic and powerful tool. So if I could ask for everyone to check out our website and give us a try.
All right, Harold from OrisDX.
Yeah, for us, it's really simple. Dentists need to shout out, make a lot of noise to the American Dental Association to say, we demand precision diagnostics in our practices. That's it. Everything else is easy.
Philippe.
So for us, it's integration with every third-party software. We believe that dentists and across the world are fed up about having 10 platforms on the computer. So integration, we want to become the Intel inside of the dentistry. Integration.
Pam from Grin.
Great. It's hard because I echo everything that a lot of people said here: integration, distribution, education. But I actually had a little bit more, and this follows Harold's, I think, answer in terms of policymakers. So I think one of the things, and it relates to why this is only the second year that dental health is represented in the health in the digital health hub, and then in health in general. I think there's more conversation to be had on the policy making side of things. That's why we are collaborating with organizations like CareQuest, why we're pushing on Head Start programs to allow young children to get Medicaid thanks to oral screening and so forth. So there's work to be done there. And I think once policymakers kind of understand and policies, that's the money will start flowing to the right direction, and then there'll be implementation at a higher scale.
All right. Last but not least, Jinesh, please wrap us up.
Education, I think, echoes everyone else here. People need to understand equipment is a core part of healthcare, and providing it and protecting it's going to protect our care.
Great. I think we went through all of you.
We didn't miss anybody, right? You're not
someone?
a shy bunch. You'll have told us you got missed out. Fantastic.
You're not a shy bunch. I'm very impressed with the timekeeping skills here. All right, Matthew and Melissa, back to you. Do you want to wrap us up?
Yeah, I think so. So, I mean, Maria, you've been looking at this area for quite a while coming here, and I think it's it's the big message we're taking away here, which is completely obvious. But if you look at how American healthcare is organized, most healthcare is organized, not the case. Is that your teeth are in your mouth, and your mouth is part of your body. And we've kind of got there with mental health. People are kind of figuring out that mental health and physical health are interconnected. But the fact that dental health is a whole separate set of professionals, separate set of insurance, separate set of delivery and everything else, making that integration back with the whole of the rest of the healthcare system is something we need to do, but just because of all the stuff you showed us right at the start, Maria. So really wonderful. Yeah. Okay, well that wraps it for oral health. You will see us, I'm about to hand back to Melissa, but you will see us award this in Vegas. The date is October oh God, I'm blanking on the date.
October 21st.
October 21st.
21st.
I can't believe you don't have this memorized by now, Matthew. It's only the highlight of the year.
Absolutely. Okay, so October 21st, there will be multiple different awards, both through the day and at night on the stage, and then there's the after awards party. So lots of stuff going on. As you see there, I'm now speaking over Melissa. Melissa, I will shut up and let you explain all. That's the end of oral health and dentistry. Melissa, please take us away.
Thank you, Matthew and Maria, and to all our finalist companies. Thank you for joining us for this great conversation today. We invite all of you, especially in the audience, to join us at our grand finale on October 21st at 5 p.m. on the disco stage at Health. You can click on the QR code on the screen to reserve your spot. Obviously, our finalists will be there, and we will be announcing our winners. Thank you all again, and we'll see you in Vegas.